So, hi, I wanted to share some, I think, exciting news in the medical field that we have been doing, some of which we've been doing for a couple of years now, and some of which we've been doing for, well, close to 20 years. But there's very new applications for what we've been doing that are pretty exciting. So, what I'm talking about is fat grafting. And you may have heard of that. That's where we harvest fat with a liposuctioning technique, usually harvesting tiny little bits of fat that then we collect, and we process the fat into multiple small syringes, and then we can use that fat by grafting it into various places. The most common of which that we've been doing for a couple of decades or more is fat grafting to the breast, and we've been doing that in the setting of radiation after breast conservation. So, radiation is taught in medical school as it has an effect on the tissues that affect primarily the vessels. It affects rapidly dividing cells as well, which is why it's used for cancer treatment. But it also affects the vessels such that it makes the vessels thicken their walls over time. And as the walls get thicker and thicker, the lumen, where the blood actually traverses and passes, gets smaller and smaller, and therefore sort of exponentially reducing the amount of blood flow and the amount of oxygen that gets delivered to the tissues. Which is why folks that have had a fair amount of radiation, or after enough time has gone by, the skin will oftentimes become a bit thicker, less mobile, less pliable, often drier, sometimes darker in color. That's called radiation fibrosis. And so, as plastic surgeons, we've been treating that with fat grafting, and then have been quite stunned to see these patients come back at 6 months, oftentimes with near normal appearing skin on that side, which really was not supposed to happen, since the radiation changes are usually progressive over time. So that prompted some research to be done, in which they examined the amount of blood vessels that were present in the breast prior to and then subsequent to the fat grafting. And what they found was, with the use of magnetic resonance, like an MRI with contrast dye, was that there was a whole vast new world of blood vessels that grow into the breast after the fat grafting process. The thought is that the cells in the fat that are no longer connected to capillaries will create a signal to the rest of your body, signaling the fact that you have tissue that is lacking blood flow, and your body will grow in new blood vessels to save that fat, and in fact does save about half of the fat that we graft, kind of no matter where we put it. So we've been doing that for breast reconstruction. We also have been doing it with pretty much every facelift. I would say most plastic surgeons would prefer to graft some fat. It brings in extra blood flow to the skin. We now know that. And in doing so, it brings in more oxygen. And in doing that, that actually gives the skin a much more youthful appearance. So, fast forward to just a few years back, and someone, not myself, but someone brighter, far, I'm sure, took some fat graft and put it into the first CMC joint of the hand, which is the most commonly arthritic joint of the hand, the base of the thumb. And they found that those patients had their arthritis markedly improve over the following year. So now I've been doing that for a couple of years, and I too have been quite stunned by the effect that it has had on patients that have really devastating arthritis, unable to bowl, unable to cut hair anymore. And now these folks are back doing some of the things that they like to do that they couldn't do before, and with very, very minimal downtime. So the process is basically with a syringe. I harvest the fat with a syringe, and then I inject the needle into the joint with a very blunt, with a very small but blunt needle, and putting some fat into the joint, but a lot of fat around the joint and in that whole area. Then you have about 2 weeks of downtime. Where you're not really using the hand a whole lot, but then right after that, you're back to using the hand normally, and the benefits usually progress over time as those vessels sort of grow in. So I have just applied for an IRB approval for a study looking at fat grafting for some new applications. So the arthritis of the base of the thumb is covered by insurance. It is not covered in the rest of the hand. So we're going to look at fat grafting other arthritic joints in the hand, much like my hands, which I would like to have grafted. If any of you are plastic surgeons with the ability to graft fat into joints, then I would love to have you come and do my own hands. Um, the other things that we're going to be doing it for, which is an even newer indication, is for diabetic neuropathy. So there's research recently that's shown that fat grafting to the soles of the feet in patients with a lot of foot pain, with standing, or patients with wounds that are chronic and non-healing, that the actual new blood vessels, a new oxygenation, presumably that's what's doing it, has allowed a lot of these wounds to heal and a lot of their foot pain to improve. So that's a new application. We'll be looking at it for folks that are experiencing relatively rapid predicted hair loss with familial hair loss, usually folks in their 20s that are losing it more rapidly. I believe it will reduce the speed at which hair is lost. So we're looking forward to that, beginning that process, hopefully sometime in the next 2 or 3 months. Let me see, what else is there? We're also going to be using it. There's evidence to show that it improves tennis elbow and also golfer's elbow without really a big surgery. It's a small in-office procedure that can be done under local anesthetic.